Next, we'll take a step back and explore how one toxicologist is using his interest in emergency medicine to address envenomations. He will give us a perspective when it comes to climate change on his work. Dr. Nicholas Brandhoff is an emergency medicine physician and medical toxicologist with a focus on envenomations. He is an appointment as assistant clinical professor of emergency medicine at the University of Colorado School of Medicine and is faculty at the Rocky Mountain Poison and Drug Center. He is also medical director of a nonprofit, the Snakebite Foundation, that focuses on improving snakebite education and management in West Africa. And he is also the medical director for Snakebite Management Solutions.
Hello, my name is Dr. Nick Brandyhoff, and I'm an emergency physician and medical toxicologist based in Colorado, in the United States. I'm also the president and medical director for the Asclepias Snakebite Foundation, which is a foundation that provides training and resources to clinics in Guinea and Sierra Leone that are heavily affected by snake envenomations. Today I've been asked to discuss climate change and the effects on snake bites that may be potentially occurring down the line in Africa. I have no financial disclosures to discuss. Objectives today include discussing climate change projections, how climate change effects may occur on human health, and how climate change may affect snake bites in the future. As you guys already probably know, Africa is the fastest growing population in the world. It's projected to double by 2050, adding 1.2 billion people to already 1.3 billion people on the continent. This alone, without climate change, is going to increase the needs of various resources, including healthcare, education, agriculture, urban land expansion, as cities have to either become more dense or grow in order to sustain the population, jobs, and then resources such as water, food, etc. Climate change has been called the greatest threat to human health in history. The Earth is rapidly heating up, which is going to affect our daily lives. The effects of climate change are likely to be severe. We're going to have extreme bouts of heat and droughts. Other areas may experience extreme rain and floods. There's going to be a reduction in crop productivity, which is going to lead to undernutrition. People are going to have to migrate more in order to find work and suitable places to live. There's going to be a change in waterborne diseases and different vectors, diseases such as malaria, and then it's going to have an increased impact on wildlife and likely to have a massive extinction event. This is an example of the potential effects that Africa may experience. This is a representation of the number of heat wave days per year across the African continent by 2050. As you can see, in very specific bands of Africa, there's going to be a significant increase in the number of those days. This is a representation of the potential increase in hot nights per year across Africa by 2050. As you can see, with 3 degrees Celsius increase, almost the entire continent will be affected. A hot night is determined to be in the top 10% of temperature on average taken between 1971 and 2000. This is a significant increase that will increase mortality around the region as people are unable to get respite during the night from the hot days. This is a projected change in the number of days with intense rainfall per year across Africa by 2050. As you can see, the regions most heavily affected are along the coast, but when you get up into the 2 Celsius and 3 Celsius change, places farther inland are affected. This significantly will increase flooding and potentially ruin crops. It may also change land management, as some areas may be permanently flooded and non-inhabitable by animals or humans. Some example of some severe flooding that has already occurred shows the economic repercussions that can occur when severe flooding happens. So Tanzania, for example, experiences $2 billion US per year in infrastructure damage due to flooding. Nigeria had a significant flood in 2012, causing $10 billion US in damages. And Mozambique had a flood in 2013 that cost 9% of its GDP in infrastructure damage. By 2050, there's supposedly supposed to be $1 trillion US worldwide damage annually that we're going to have to account for. Climate change is not just a health issue, it's an economic issue as well. As you can see here, the capita GDP by 2100 by country is going to be affected largely in areas that are already heavily affected by economic distress or poverty. So areas such as South America and Africa. The impact on human health from climate change is going to be significant. There are multiple areas where we are going to be affected, including access to water and food. Severe weather is going to cause us to have to migrate to more inhabitable positions. Patients with already chronic conditions are going to have exacerbation of those conditions due to extreme heat affecting areas such as cardiovascular disease or air pollution causing increased asthma. There's going to be change in vector-borne illnesses such as malaria, dengue fever, chikungunya, West Nile virus, and waterborne diseases such as cholera, leptospirosis, and algae blooms. The largest effect is likely to be malnutrition and access to clean water and good food. The regions most affected by this are likely to be, again, areas that have lower GDP. Those include South America and Africa. As you can see there, the red signifies a significant increase in the number of deaths by 2100 due to climate change. Even without climate change, snake bites in Africa are a big issue. In 2017, the WHO designated snake bites as a Category A neglected tropical disease, putting it along the lines of malaria as an issue that needs to be addressed at the highest level. Currently, there are 1.5 million envenomations per year in Africa. With an unknown number of deaths, we have a lot of models, but we're unable to determine the exact number of deaths that are occurring. From other statistics, we know that approximately 3 times more people develop morbidity than mortality from snake bite envenomations. This is largely due to developing limb dysfunction or loss of limb from the envenomation. And in Africa, only 10% of those envenomated actually receive any anti-venom, which is the cure for snake bite. The large majority of people who are bitten are those who are young, healthy. They typically are agricultural workers, and they typically are the breadwinners for the family. When they get envenomated, not just the patient themselves get affected, but the victims' families as well, as they are no longer able to sustain themselves financially. There's a large economic burden that occurs with snake bites in the region. Snakes inhabit a very specific niche in the environment. They are ectotherms. They do require external heat source in order to stay warm. Many of them have very specific ecological needs, such as green mambas living in the trees and puff adders living on the ground. They require a unique range of temperature in order to survive and a unique range of humidity in order to survive. They're not very adept at migrating, such as large animals, and they're very dependent on their food source in order to stay in their unique habitats. The current projections suggest that specific areas in Africa are going to get wetter and hotter or drier and hotter. There's going to be a north to south migration of snakes depending if they're above the equator or moving from north to south if they're below the equator in order to avoid the hot temperatures that are likely to occur in the equatorial regions. Some populations may just go extinct because they're unable to adapt completely and unable to move to more suitable environments. Due to this migration of snakes along with humans, it is expected to increase the rise in snake-human interactions, which is likely to result in higher levels of snake envenomations per year. There is a unique paper by Zacharias and Loya looking at climate change impacts on distribution of venomous snakes in Mozambique. What they've specifically shown is that Mozambique, due to the unique environment in the south, are likely to have a decrease in snake density in the south and an increase in snake density in the north. They've also done projection modeling in the future that the areas of red and yellow are likely to increase the population exposure to potential venomous snakes, whereas some areas are actually going to have a decreased risk and reduction during this time. Decreasing mortality and morbidity from snake envenomations is all about mitigation of potential interactions. We're not going to be able to exterminate snakes in a given region as they play a very important role in the local ecology of given areas, but we can educate people about potential snakes in the region and how to avoid them. We can decrease the inhabitable nature of surrounding buildings and structures. We can educate farmers on how to avoid snake bites or when to avoid snake bites. And really the biggest decrease in morbidity or mortality that may occur after an envenomation occurs, making sure that people have adequate health care and access to appropriate antivenoms that are useful in that region. So in summary, climate change is a global threat for everyone in the world. Africa itself is only getting hotter. There are some places that are going to be wetter, resulting in increased flooding. There's some places that are going to be drier, which is going to cause significantly decreased agricultural output. Snake bites are going to increase in the area, so we need to be prepared for this by doing long-term planning and helping to mitigate potential snake bites. Thank you for inviting me to speak. If you guys have any questions or concerns, please email me at any time. I'm happy to reach out and talk with anybody who would like to. Thank you.